welcome back to Dr. Ruthie's Corner. So I'm finishing up some videos from questions I had last week. This question is, I have chronic hip and lower back pain. I have a history of being in a car accident, and I feel like my hips are getting tight and painful when I do a lot of walking, hiking, and running. This is really common. Unfortunately, what we're seeing in women in the orthopedics world is an increased rate of labral injuries. So in the hip, you have a socket that's on the outside of your pelvis. This socket can be deep, it can be shallow, it can be tipped, tilted, and then the head of your femur, which is the long bone in your thigh, has a neck and a head. So we think of that as the ball in the socket, right? That femoral head and neck can also be tipped and tilted. This is the single most variable thing that we see anatomically, and it's a big argument in the weightlifting community about what is the perfect squat stance, right? How far apart are your feet? Where should your feet be pointing? I use some of this diagnostically in my job, but realistically, we have to look at what is happening with women who work out a little bit more than we have been. So I'm going to just tackle that hopefully in a light, accessible way. And the bulk of what I'm going to say is the muscles that surround your hip and pelvis are not equally matched. So more than likely, you have some muscles that are showing up too much and some muscles that are not showing up enough. And so clinically, how I tend to treat that is I break it down. It can get pretty in the weeds when you treat somebody, but there's a couple of easy things you can start paying attention to that should help you feel like your hip feels better. And the key for me is that it's the hip and the low back together, and there's one muscle that really links those suckers. So we're going to talk about it. So in your hip, okay, so here is your hip, all right? And so your pelvis, your larger pelvis, has its shape like a bowl. So we're going to start with the pelvis first. So the front of your pelvis has two pokey, pointy, sticky-outy bones, right? If you lie on the floor, you should kind of feel those. And then you have two sticky-outy bones in the back, right? These are called your sacroiliac joints, or SI joints, and people have typically heard of those. But they never hear of these guys in the front because they don't hurt typically by themselves. But when we talk about slings, or force couples, those are two theories about how biomechanically, which is a very big word, but I love human biomechanics, it's how your body works in motion. And so we work on force couples and slings to move us through space and keep that head in the sockets, right? So the femoral head in the socket in the pelvis and working well. If that's not happening, we'll get snapping and popping and then joint-specific pain that can sometimes feel like something's wrong with your joint, something is stuck in your joint and you're not feeling good. So in women in particular, although this does happen in men as well, this is what I see. So here's the front pokey pelvic bone. It has a very long name. I don't expect you to remember it. So front pokey pelvic bone is what we're going with. Sacroiliac joint. Right? In a balanced pelvis, those should kind of line up. So this is an anterior pelvic tilt, okay? And for me, the closest I get is lined up, but there's that other body type where people kind of tuck under, and that's a posterior pelvic tilt, okay? That's just not the body type that I have, but just so that you know the three different types. Okay, from here, right, if I was to move from my two bony prominences, the sacroiliac joint and the pokey pelvic bone, and come around, that should be the center of my hip. And then if I slide down from that, I should feel the bone of my hip. So see how I'm kind of windshield washering that leg? I'm kind of twisting the head of the femur in the socket. What should happen is I should feel my femur in this line. So even in the seam of your pant is a good way to think about it. That is not where I ever find the femur in people who are having this kind of back and hip pain. What I typically find is the femur is like up here and high. So what's happening there is your hip flexors, so the muscles that pull either your trunk towards your pelvis or your thigh towards your body, right? That's hip flexion. That's that motion. We name all these. So hip flexor. Those hip flexors are typically very tight. How do our hip flexors get tight? Look at how I'm sitting right now. I'm sitting with my hip flexors tight. So just sitting by itself, a long commute, a lot of time spent sitting, which we're all doing right now, all of those things can just shorten up your hip flexors and cause them to be tight. So the question I always think about is, okay, let's try to eliminate or reduce any activities that are causing the tension to build. So causing that muscle to shorten in a way that's pulling on the femur, right? So again, we're thinking anything in the front that's pulling that femur forward, we want to limit that. And then what muscles pull the femur back? So weirdly, the muscles that pull your femur back are your adductor, your long muscle on the inside of the thigh, kind of pull the femur into the socket. So when I'm training my patients, this forward movement is kind of out of the socket, where backward movement is almost deeper inside the socket. This is not the same as like if you sublux or dislocate after a hip replacement. That's a totally different topic. Okay, this is for active, middle-aged females. All right, so the glute. The glute is the counterbalance to all your hip flexors. So the hip flexors that you have deeply are your psoas. You can find your psoas, belly button, 1 inch to the side of your belly button is your psoas. That's the only place you can feel it. Otherwise, it's a hidden muscle. And so when people have this nebulous, I can't quite put my finger on it, pain, it's usually that one is somewhat involved. Your rectus femoris, so it's your longest quadricep muscle, and that's why I'm in this position. So it starts at that pokey pelvic bone, and it goes all the way down the thigh and crosses the knee. So if I try to do this stretch, see how I can't quite lift up my foot? I should be able to get my foot the rest of the way up, but I couldn't really do it. That's a sign of tension. So the fact that I couldn't really do it tells me that my hamstring and my glute are not as strong as my quad and my hip flexor. So you can do this test on yourself. So if you kneel on a comfortable surface and just try to pull your leg up, if you don't get very far but you can passively move it more, that's hamstring weakness. So one of the things that you can do is focus on glute and hamstring weakness and get this quad and hip flexor stretched out. That's one of the first things that you can do. It's great. So in this kneeling position, sometimes what I do too is a little lumbar work. So if somebody's pelvis is not in line, they will have this hip hiked up. And so I'll just tell you, like, so the leg that's forward, right? The leg that's forward, the hip is hiked. So I'm hiking my hip, and then I'm dropping my hip. And I'm hiking my hip, and I'm dropping my hip, okay? So I want to stay dropped in that hip. So I'm getting kind of a long stretch through here, but I'm also training this leg to be in the socket, not pulled forward. See how that changes the orientation of my pelvis? So you want to stay in the socket. And then from here, I can do some glute activation. So I'm here, I'm going to squeeze that glute, and as I squeeze that glute, I should feel like my femur pulls back in the socket. I might even feel, if I'm really tight here, that might feel like a big stretch for the hip flexor. So if I'm not tight here, but squeezing that glute causes that hip flexor tension, you know that hip flexor is getting in the way and causing pinching and some other problems that we're experiencing, okay? So in half kneeling, hip hike, hip drop, hip hike, hip drop, settle, glute squeeze, relax, glute squeeze, relax, glute squeeze, relax. So you can do sets of 5-second holds. You can do 10-second holds, work your way up slowly. I have some patients who get in that position and the glute doesn't even fire. It does nothing. And they're like, what is going on? Well, there's like a funny term that we call it in PT. It's dead butt syndrome is what we call that. And effectively what I see, again, in women, we're going back to this body type. You're really tight here, so you end up in the anterior pelvic tilt. So in places where your glute should be showing up, your low back shows up and does the work instead. So you kind of do one of this, right? You tighten up your low back to do the work instead of tightening up your glute to do the work. So in a previous video, I talked about your core a little bit. So that's the other piece of this, is when your hip flexor tries to act like your core because you've been training your core wrong. And if you didn't watch that video, you should. So good core strengthening is blowing your air out. So blow up. When I do that, some of the force couples that should be firing, right? My deep core should be connecting my pubic bone to my rib cage. I have to limit my leaning back. That's my particular cheat. So if you saw that, that totally did happen. That's what I have to train my body not to do. So I'm going to blow up. Right? Ribs down, pubic bone up, invisible bungee here, right? That's going to lengthen me through my hip. And now I'm just going to really squeeze both glutes at the same time. And so I'm going to get a lengthening here and a shortening here. That's going to make my back longer, right? So if I do, I'm going to unclench. See how my back got shorter? And I kind of dipped a little bit. So then I'm going to blow up and squeeze. See how my back got longer? So that's telling you that you're working out of this pattern. And that's your goal, is to work out of the pattern you're stuck in. That's what corrective exercise is all about in PT. So other things that you can do is practice hamstring curls. Right? So really trying to get your hamstring stronger just by pulling your heel towards your butt. That's what your hamstrings do. It is okay to have strong hamstrings. They help keep you from being in this position, right? My hamstrings anchor from the tip of the bottom of my seat, right? So pelvic floor, bottom of the seat, hamstrings pull you down. So if I'm like this, I want my hamstrings to pull my butt towards my knees. And that, again, takes the tension off my low back, makes my low back really happy. All right, so that's the front to back problem with this. The last problem is that where is the femur in the socket problem? So it's a funny exercise, but it's using your groin to kind of get the leg back. And it's an activation exercise. So I'm going to do it in seated, but I usually train clients to do this lying on their side. So in seated, oh, no, you can't see me. I'll show you on my side. All right, so here I'm going to lie on my side. Okay, so I have to find those parts of my pelvis again. So pokey pelvic bone, sacroiliac joint. Most people tend to be rolled back when they lie on their side. So straighten out that bottom leg, bend up that top leg, and roll into it. Okay, so that pokey pelvic bone should really be forward. Now, if I get my fingers in between my thigh and that pokey pelvic bone, I might feel a lot of tension there. Guess what that is? That's your hip flexors. That's probably the hip flexor that's pulling the head of the femur, right, the head of this long leg bone forward, creating a pinch or an impingement, and it's painful. And it does, again, start feeling like tension and tightness at first, but the longer it goes on, the more it feels pinchy, hard, bony, in the joint. It's uncomfortable. So in this position, I'm going to stay rolled forward. If I put my arm back here, right, that's going to put a strain on my body, and my body's not going to like that. So I'm going to stay forward. And what I'm going to do is I'm going to take my thumb and I'm going to hold in that area. So what we're trying to do, right, we're trying to turn off the hip flexor. So I should be able maybe to get my whole hand in there and just push that down. That's going to help tell my hip flexor, you're not needed for this activity. We don't want you to show up. And again, if your hip flexors are on and short and tight, they've been showing up for a lot of work. Okay. Then you're going to put your hand on your inner thigh and you're going to try to squeeze with just your inner thigh, your knee straight down into the pillow. Okay, so your femur in this position is acting like a lever. So if I lift my knee up, my femur goes down. If I lift my knee or push my knee down, my femur comes kind of sticking out. So if I put my hand right here, and again, in between your sacroiliac joint and your pokey pelvic bone, come around, that's where your femur should be. So if you don't feel bone right there and you had to walk your fingers forward to feel the bone, you have this forward femur problem. So if I squeeze the pillow with my knee, right, squeeze down in the front, I should feel my femur push back. And so again, this is a femur corrective exercise, right? So squeeze. You can do this sitting, and if you're doing this sitting, you sit in a chair, you touch the front of your pokey pelvic bones, you squeeze a pillow, but what you don't want to feel, if you put your finger on that pokey pelvic bone and you feel that muscle jump underneath your finger, that's your hip flexor showing up for the wrong job. Your hip flexor is going to be tired and irritated, and then it's sort of like, you know, you guys ever watch road work, right? Your glutes and core are going to turn into the 3 guys standing holding a shovel doing nothing while the 1 guy's in the hole. So we need to get your hip flexors out of the hole, and we need to get the other guys holding the shovel contributing, so that not one person is overworked, tired, irritated, shortened, causing problems for the whole crew, right? So that's how I want you to think of your hip to pelvis, right? It's a whole crew. Nobody should be leaning on their shovel doing nothing. If you have questions, post them below and I'll try to answer them in follow-up videos. Thanks for watching.